Well, we are just at that 1 year point about when our world shut down because of COVID-19. To say it's been a long year, well, that would be an understatement. But mental health continues to be an important conversation. Dr. Sara Heron is a Bay Area child, adolescent, and adult psychiatrist, joining us now to talk more about this. Dr. Heron, thanks so much for being with us.
Thanks for having me.
So the mental health discussion has been ongoing, so important, but the problems and the need also so great. And as we come to this 1 year, what do you think the lessons learned for us have really been?
Well, I think social isolation, we've known even prior to the pandemic, definitely takes its toll on anybody with any mental health disorder, as well as the average person. And so we know that people who already had a mental health problem are going to be put even under more strain. Financial strain also adds stress for people. And so it's things that we knew before the pandemic, but the pandemic has really exposed it in a different way and made it something that everybody really can relate to.
I was having this discussion with someone just the other day, too, about how, the road back to a healthier mental state is long. And you take a look at, these reopenings and schools going back, and it's easy to say, okay, whew, we're better now, and it should be fine. But I don't think that's, what I'm seeing with people. Their patience is stretched so thin. They're just still struggling a lot, even though things are getting better and even though there is light at the end of this tunnel.
Yeah, I mean, if we think about a trauma reaction, which for many people going through this pandemic, losing loved ones, losing jobs, again, really being under a lot of strain and not having the normal resources they would to get through it. If we think about a typical trauma response, that can take years to recover from. It's not snap, the trauma is over and we're all fine again.
So where are you seeing the biggest need when you're looking out? And I know equity is a big issue for you, and how we reach all these areas of our communities to make sure that everyone has access to help when they need it.
Yeah, so again, I think these were problems that those of us in the mental health profession recognized long before the pandemic, and now everyone is paying attention, thankfully. But a lot of it is going to be about advocacy, about sort of fighting for what should be standard of care for everybody, that everybody should have access to these resources. And we find that people, even who are insured or, have Medi-Cal insurance, still can't get in to see their provider for months when the requirement should be within 2 weeks. So I think it's going to be keep fighting on the advocacy front is a big part of this.
Yeah, we keep pushing it, and really when people are in crisis, it's not a crisis that needs to be dealt with in 6 months. They want to see someone right away. They're worried, they're concerned, or if you see someone and you actually notice that they need help, you need to get them help sooner than later. I do want to just mention this Meghan Markle interview that we saw earlier this week, because certainly that brought mental health to the forefront when she was so candid about talking about the struggles, saying at one point she didn't want to be left alone because she didn't think she could be left alone, and really, her husband, Prince Harry, also working on a mental health special with Oprah. This has really brought it to a national conversation as well. We were already talking about it. We've been talking about it even more.
Yeah, I think, she brings to light the topic of suicide, which people are very, there's a lot of stigma around mental health. People don't feel comfortable talking about this. But if we look at the statistics, we'll talk about diabetes, heart disease, cancer, leading causes of death in the country. Suicide is the number 10 leading cause of death in adults and the number 2 leading cause of death in teens and young adults. So, it's really past time that we're looking at this. It took a Prince and a pandemic for us to pay attention to this issue that's been going on for years.
Yeah, and hopefully we continue the conversation, learn from this, and make sure that we're looking out for ourselves and each other, and get the help to people who need it. Thank you so much, Dr. Heron. We appreciate it. We'll have to leave it there, but thanks so much, and thanks for all the work that you do to make sure that people are getting the help they need.
Thanks so much for having me.
Your time now.